Before we start, I'd like to also acknowledge the traditional custodians of the land on which we're gathered today, pay my respects to their elders past and present, as well as any First Nations people who may be here today. Sovereignty was never ceded. This was and always will be Aboriginal land. I also want to acknowledge anyone in the room with lived or living experience of substance use or addiction, mental health challenges, suicidality, or any other life challenges. So my name is Joshua Finn. I am the Senior Legal Policy Advisor at Mental Health Victoria, and I'm very excited to be here presenting, or not presenting, I'm emceeing. But I'm very excited to be emceeing this session on culture change. For anyone who knows Mental Health Victoria, we talk about this a lot, but I'm going to try to resist the urge and actually stick to my job, which is to introduce Micaela Cronin, who will be speaking today about workforce collaboration and future directions. So Micaela is the director of the Workforce Innovation and Development Institute, or WIDI. WIDI drives innovation in education, training, and applied research to enable the growth and transformation of the social service industry, ensuring people who are directly affected are at the centre of WIDI's work. Micaela has held many leadership roles across the broad spectrum of the social services sector, both in Australia and internationally. Prior to her role as director of WIDI, Micaela was the global CEO for Hagar International, working across Asia and building global service delivery and strategic partnerships to tackle human trafficking and human rights abuses. Since commencing at WIDI, Micaela has built on a strong social service industry knowledge and relationships to deepen WIDI's partnerships with industry and government, developing and scaling earn and learn models that have led to significant improvements in student retention and employment outcomes. So without any further ado, please welcome Micaela Cronin.
Josh. Okay, so I would also like to add my respects and acknowledge our First Nations people and the importance of keeping at the front of our mind when we are talking about the types of services and policy and program areas that we are, about all that we have to learn from Indigenous communities and elders, and all that we have to think about in the reparation that needs to be done about the harm that is not only been done in the past but is ongoing. I would also really like to thank and acknowledge how well the agenda has been put together to put at the centre people with lived and living experience, and how important that is to be thinking about when we're designing what the future needs to look like. So the Institute was established 6 years ago, and it was initially that the impetus for establishing the Institute, which was always a partnership between the sector, government and RMIT University, was the introduction of the NDIS. So the major change that was being heralded, and the recognition that that was going to have huge implications for workforce. How do we grow and build the scale of the workforce that is needed, and ensure that we've got the skills and capabilities? I started working in my career as a social worker in family violence, sexual assault, and have worked across a range of different areas as a service delivery person, and then into leadership roles. And I wanted to start by also acknowledging the experience in the room. How many people in this room and online have experienced a policy reform that has impacted on service delivery design and your job? How many people have experienced that more than once? So we've gone through cycles of policy, government in a range of different ways, trying to address in fact, I'm going to slip to the next slide, the challenges that we're facing. So not one speaker this morning has not talked about workforce. Not one speaker has not mentioned the incredible challenges we find, which is encouraging to some extent, because I think that there've been rolling reform in the past that has not necessarily recognised the impact that that's going to have on workforce and what's needed in terms of the foundational work that needs to come. We've been doing a piece of work with Family Safety Victoria as part of the Royal Commission into Family Violence that has been about looking at what the reform is needed in terms of workforce design. And everybody that we're working with, we've been doing that for over a year now, everybody that we've worked with, including government service providers, has said the piece of work we're doing now should have been done 6 years ago. The work that we're doing is detailed mapping of the workforce and what the jobs are. And we know that we don't have anywhere near enough visibility. In fact, Catherine Wheaton recognised that and said we don't have the data we need. Government don't know what the funding at the moment. The Institute did a piece of work in January so this was DFFH, not health, about looking at, they were particularly interested in what the vacancy rates were. And when we started talking to them about the workforce, government can't tell you, in fact agencies can't tell you, so it's not just government can't tell you, how many people are in the workforce, how many people are employed to undertake service provision funded by government to deliver these services, whether that's homelessness, family violence, disability. And Catherine acknowledged, can't tell you that about mental health or drug and alcohol. So if we don't know how many people there are, we don't know what the jobs are that they're doing, it's very hard then to design strategies and solutions about what the future workforce needs to look like. And I really want to point to, there's one of the things that I've been really impressed this morning is the commitment to understanding the problem that we face from multiple perspectives. None of us have a view of the problem that is going to sufficiently provide information that will help design or implement those solutions. You need people who are living with the experience of services at the moment. What's their perspective on it? Service providers. You need to understand what the unions are hearing about what workers are saying the experience is like. You need government's perspective in terms of policy reform and what's possible. What is it that government is going to be prepared to fund? And you need training providers and you need community and family. You need all of those because while we have a shared problem, the devil is in the detail. Understanding the detail of what the problem is and the challenges are will be slightly different in AOD than it is in mental health, than it is in disability, than it is in family violence. We've been doing a couple of major workforce projects and we do a lot of work with the disability sector and the family violence. We do a bunch of other things, but two of our biggest projects are family violence and disability. And the differences in the workforce challenges are critical to understand. Disability, large part of the workforce are entry-level roles, people who are doing personal care work. And the qualifications that they need, the experience, the demographics of that workforce are different to family violence. One of the unintended consequences of the way the Royal Commission's recommendations have been implemented in the family violence space, for example, is very targeted interventions that mean that organisations have short-term funding that is very specific. And they have a whole lot of, we called for job descriptions. Give us your job descriptions that relate to the implementation of the Family Violence Royal Commission. We got 700, more than 700 job descriptions for really about 12 roles. But because they're targeted short-term roles, It's very hard for organisations that are much smaller organisations in family violence than disability to plan the workforce, because they have to employ people to implement the latest initiative, short-term funded initiative, and then those people are on short-term contracts, and then they've got to work out how to transition them. So while they both have retention and recruitment challenges, without understanding the detail of what those retention and recruitment challenges are, it's very hard to design what the strategies will be to improve recruitment, retention and career pathways. Because the other challenge we've really got as a whole sector is, where do people come from that are working in this sector? Where do people come from? Where do they go to? What skills do they bring when they arrive? What's the upskilling you're going to need? We need to understand more about what the career pathways are. There's a lot of anecdotal evidence about that. People will say, graduate social workers tend to start in either child protection, because that's the government-employed workforce, and they kind of suck a lot of the oxygen out of wanting an entry-level graduate workforce. Homelessness, they get a lot of the beginner, entry-level workers. Where do they go? What do they learn? How great would it be if we had greater visibility of those pathways and could help plan them? Because if someone's got experience of homelessness, family violence, AOD, mental health, those workers are going to be able to have a much better capacity to deliver joined-up, integrated, knowledgeable service delivery, to get better outcomes for people who are living with a whole range of needs. All of us know that. You don't, just because you turn up to one door seeking a service, we've all got complex needs. So, understanding what the detail of the problem is requires really listening humbly and not assuming you know the answer to that. What else did I want to say about that? The other thing that we've been doing a lot about is the training. I don't know about you, but when I did social work and then I turned up to my first day in my first job, I was very lucky to have someone down the corridor who mentored me and took me under her wing and helped explain what the systems were, because I had no idea how to do the job, really. I'd learnt a lot, it was a valuable qualification, but I had no idea how to do that job. And one of the things that I think the impact we're hearing, the impact of COVID has been, is a lot of that informal mentoring and coaching that you're not getting. Because it was Robin down the corridor who took me under her wing, and I sat in her office, and I remember writing lists when I was meeting with her about what was I going to ask people, how was I going to plan. There was nothing formal about that. She was a peer, and I learnt so much from her. We've lost a lot of that during COVID. The other thing that's been happening is, because there's been this explosion in frontline workers, family violence, wherever the funding is, there's been this sucking up of people who have very little experience into management roles. And we're hearing more and more about that, and there's evidence from your sectors that people are moving into leadership roles when they've had as little as 2 years experience themselves. And if that's the experience they've had, then they haven't had the mentoring and coaching that helps them learn how to do those jobs, and they've missed it during COVID. So purposefully creating pathways, understanding where the skills gaps are, understanding how we can build those over time, a bit like the public service graduateship kind of programs, that you join the public service and hopefully you get experiences of working across a range of areas. I met Catherine Wheaton, I think it's about 8 years ago, when we were doing the Sector Reform Council process, and she was in DPC, I think, and we were talking then about workforce and the need to have joined up workforce, because the other thing that happens when you move around those roles is the networks you build. And the people that you can call and say, hey, what do I do? Who do I talk to about this? How do I get through that problem? One of my first jobs was a homelessness worker in a sexual assault centre. And when I started, the Sexual Assault Centre's policy was not to work with anybody who didn't have a fixed address because they weren't then going to be able to address their trauma. But when you're talking about young homeless people, but our job was to help do the connecting up across the dots and to do the networking. And again, we've had real challenges to that. So we knew we had a problem about workforce. We knew we went into the pandemic knowing we had high vacancy rates everywhere. We've got investment that is coming from the Royal Commissions that is pretty siloed and means that everyone's talking about what happens is there was someone said it was much nicer than cannibalising. What was the phrase before, Sam? Movement, we're not growing the pie, people are moving to where the funding is, that because, they need stability of employment or a little bit more pay. We now are in an employment market position that means that, boy, if we don't start to really seriously think about doing things differently, we are going to be in an awful lot of pain. We've got the lowest unemployment levels in a long time. There's a whole lot of underemployment still that sits behind that, and actually where the social and community health sector is contributing to that a bit because of the way we employ people sometimes. We've got the highest vacancy rates ever. One of the programs we're running is a traineeship helping getting people into entry-level roles. And we started that about a year and a half ago now. And when we started, it was all about, it's the Working for Victoria scheme that Jobs Victoria run. It was all about people are losing jobs because of COVID. How do we help them transition into other sectors? We designed that program based on that we had a supply of workers who'd lost their jobs. We now have really no supply of workers. We're looking at how do we find them. And how do we help create pathways into the sector. And we've watched the most dramatic changes in the employment market. One of the recruitment companies we're working with said, you need to assume when you're recruiting that anybody you're speaking to is actively engaged in 4 other recruitment processes at the same time. At least on average. They're being interviewed for, they're being headhunted for at least 4 on average. And that if you don't move fast enough, then if they'll get an offer from somewhere else, you can lose them really fast. You can lose them because they might be put off, and one of the things that we've really experienced with the sector, particularly the project we're doing with disability and aged care, is they're too slow. Their pipeline, and some of that's not down to the organisation's faults. They've got to get checks and clearances. They've got a whole lot of people they're working through. But organisations, we've got to look at our recruitment processes and practices. We've got to be thinking about how do we grow the pie, because they also say, we've got very complex jobs. We can only take people who've got experience. Well, where are you going to get people who've got experience? Where do they come from? They come from other organisations who are doing the same thing. So what are we doing? We're poaching from each other in ways that means that, because it's not functional for my organisation to be recruiting a whole bunch of people. And in the point that I think Marcel and Sam made really well this morning, if both sectors aren't functional, you're in trouble. If your organisations aren't viable, and some of the disability organisations we were working with over summer when Omicron hit were getting to the point where they said, we are not viable, we're actually going to have to close our doors. And that's disaster. What happens to all those people who are in those residential facilities? I'm using those examples because we've done really detailed program work, but it's the same in your sector, I know. So we've got to be thinking about how do we grow the broader pie? How do we integrate better than we are now? How do we think about building people's skills and the pathways? And the other thing that's happened, one of the other unique things that's happening that's a real problem in family violence because of the way the reforms have occurred, is that they don't have entry-level roles. They're not funded for entry-level roles anymore. They're funded for complex. They're funded to deliver at the level that the Royal Commission recommended they needed services to be delivered at the more complex end. But where do you find people who are skilled to do those jobs if you no longer got entry-level roles that are training, coaching, mentoring people up? I look at some of these organisations and I think about the jobs that I started in. I think I wouldn't have got one of those jobs. I wouldn't have got the job that got me started in the sector because I didn't have any experience. I'm amazed when I think back about how young I was and the job that I did without anybody. So we've got to think about what the pathways in are, and we need government to be thinking about all of the unintended consequences of the way their policy and funding mechanisms impact on organisations. We need 300,000 more people across Australia. That's not going to happen with small-scale initiatives and assuming that we will only, as an organisation, employ skilled and experienced people. We have to be thinking about transitioning people in who either are young people, have not much experience at all, or transitioning in from other parts of the sector. I've talked a bit about those things. How do we get here? We've all got experience of how we got here. So, we don't know enough about the current workforce. We absolutely need better data about who is in the workforce, all of what I said before. Where did they come from? What are their skills and qualifications? We don't have enough new, and we're losing people. We need to be thinking a lot more about retention and not just recruitment. There's a lot of investment in recruitment drives, but we need to be much more aware of what's going on about why we're losing people. And again, there's evidence about that we need to be gathering and sharing with organisations. We lose an alarming number of new graduates and new entrants into the sector because they start and we as a sector say, your values alignment with the way we deliver work is critical, but then they show up and actually the practice models are not aligned with what they were trained or they understood or they're committed to work in. That's a real issue, particularly disability aged care talk about that, but it's an issue across the community sector. And we need to make sure we've got the skills and capabilities. So those are the three things that we're particularly focused on. Data, getting new people in and retaining them, and then what do we need to do in terms of skills and capability building. So the piece of work that I described before that we've been doing for the family violence sector is actually very detailed. As I talked about we've been gathering job descriptions. It's developing a taxonomy of what are the actual jobs that are being done. What are the jobs that are being done now? And then what are the jobs that we need that will deliver on what we're saying the future needs to look like? And how do you get people from here to here and grow the pipeline as you're doing that? Because the devil is in the detail. And a number, again, of speakers this morning have talked about culture change, thinking about how to do things differently. A lot of that is in the detail of what jobs people are being asked to do. So detailed taxonomy and mapping of what the jobs are that people are doing now. The other thing that I was talking to someone over the weekend who rang me and said, I'm writing this report up about family violence workforce reform. And she said, I've talked to a couple of people during the week and she said, I'm a little alarmed about the duplication that's happening. And we need to be thinking about, because the other thing I think actually we need to be thinking about is the likelihood that we're going to get 300,000 new people into the sector and that we'll succeed in that. I would say, yeah, no. We're not going to hit 300. So we also have to be thinking about how we do things differently. How can we think about those jobs differently? Where is there duplication? Where are there inefficiencies? Where are there things that people could be doing smarter than they are now? Now, that's not me saying that there are a lot of people who are not working very, very hard, but we're not going to get 300,000 new people in the next 2 or 3 years. How are we going to do things differently so that we are improving outcomes for the people that we are all here to serve, and we are retaining people because their jobs they're not being burnt out in the jobs that they're doing. Data I've talked about, job design and organisational design. The other thing I want to talk about before I finish and see if anyone's got any questions or comments is that point about collaboration, that point about how do we, and the thing that I didn't hear, I heard people talk about building culture this morning. I didn't really yet hear very much about just how different these sectors are. The difference in your history and where you've come from, the difference in pay and conditions, the difference in understanding of what the problem is and what the treatment is, what the solution is for people. And there are oceans of difference between the way AOD and mental health have historically looked at that. So how do you bring that together? One of the people whose work I like, Amy Edmondson, has done some really interesting work, I think, on what she calls teaming, bringing people together who come from vastly different paradigms, practice frameworks to help solve problems and work together. And there's a really good YouTube clip, Google Amy Edmondson teaming and you'll find it, where she talks about a couple of scenarios that she gives about where people who come from vastly different paradigms come together and how do you actually manage to get the best out of them. And a couple of things that really stuck in my mind about what she talks about. One of the things she says is you need to listen humbly. You need to go into the problem-solving situation assuming you don't have the answers, assuming that you don't know what the solution is. And I was thinking when James was talking about being a start-up in IT world, about that, you know, if you're working in marketing IT, you don't assume that you know what the client wants. You go and ask them very detailed questions about what they want. I think, to be honest, and I've worked in this sector for a long time, I think we often think we're the experts. We often think we know what the answer is, and there's not a lot of humble listening between sectors. So humble listening to each other. One of the other quotes she talked about, there's a quote about Abraham Lincoln saying, "I don't like that person. I think I need to get to know them better." I remember when she put that up, I thought, oh, I do that. I do that, you know. I think so language, shared language and understanding about things, that was one of the things I really learnt when I was doing the youth homelessness project. I was based in a sexual assault centre. Someone else in the team was in one of the CAMs. Someone else was in a school setting. And we realised, because I was in my early to mid-20s, just how much, even just the barriers to cross-referral were language related. We were using very different language, and if we didn't understand what those language differences were, someone from a school welfare officer had Buckley's getting someone accepted as a referral into CAMS because they didn't know what the right words were to use to get their referral accepted. So, and we've come a long way in terms of that listening, but what needs to happen in bringing together the sectors at every level, at a sector level, at an organisational level, because we're talking integration across very different paradigms, and then getting people to team together and think about how they solve a problem, is a collaboration. Collaboration, and again, I can't remember who said this, but I think Mary O'Hagan talked about moving from participation to partnership. Genuine partnership requires genuine listening, and it's a really encouraging start to this first date that was the way I think that, again, that Marcel and Sam both talked about the perspectives from the sectors and what we need to do to integrate. So I think that collaboration and humble listening and getting the details of what the problem are and the data is how we will start to design solutions. But workforce is critical. Workforce is what does the job. You can have whatever policies, funding, James said they're overfunded. It doesn't matter how much money you've got if you haven't got the workforce who has the capabilities to deliver. I might stop there. Very happy to take any questions.
Thanks, Micaela. That was great. I'm really just here to help direct questions to Micaela. It's probably pointless, but here I am. Does anyone have any questions they want to start with? Otherwise, yeah, great.
From Debbie, she said, fantastic point about funding models supporting entry-level positions in service delivery frameworks. Wondering if you have any advice on how, where to support advocacy around this. Is there a formal or coordinated approach in this area to be able to achieve this across AOD and MH in collaboration would be groundbreaking? Yeah,
so I think that the advocacy, so we're a training research institute, and I've always from the start seen our job as to provide the evidence. That what we need to do is give the evidence and work with VADA and Mental Health Vic so that you can do the advocacy around that and work across the peaks. And I think they're beginning to see the problem. Government is beginning to see the problem. We've got to be designing solutions and going to them with joined up solutions, with agencies, peaks leading it. But yeah, I mean, I think it's a serious problem that we have around how do we create entry levels and pathways through. So we're thinking about it and happy to work in partnership. Are there any other questions online? Any other questions or comments? Yep, go. It'll be easier for people online. They can hear if you use that, so.
It's already on.
That's working, yeah. The question, or the point you raised about inexperienced leaders now in those roles, I just wondered, we're doing a lot to try and entry-level people in. What are we going to do in a way to support that development of those inexperienced skills in leadership?
So, again, we've been working with peak bodies about that. So Family Safety Victoria, we've been funded to run leadership intensives. The problem too is that those middle tier senior leaders are also flat out, you know, there's nobody, they can't, it's very hard to step away from doing the actual job. So we're doing a lot of thinking about earn and learn models. So how do you actually learn while you're still working full time, and having a range of both intensive service delivery, you know, delivery options around leadership development, that, because for anybody here, I mean, you learn a lot too from the peer engagement that you have. So how do we help create opportunities for people to learn from their peers, both certified and uncertified? So what we need is a range of options for people that will suit their professional, needs, but also their personal needs, you know, where they are in their personal career, life, kids, caring responsibilities, that will enable them to do leadership development. But we absolutely those are the two levels that the Institute does a lot of work at, entry level and leadership development, because we need leaders who are thinking about all of what we're talking about today.
Thanks, Micaela. There's lots to think about in what you've said. The issues that keep me awake at night, as opposed to the department, and there may be some crossover on this, is how do you not slow down what is a really, really important reform because of a labour workforce, yet go full pelt at trying to introduce the reforms and the changes and the framework and the infrastructure without having done, at least to my knowledge, the labour forecasting and having that component in place before you actually roll out the bits and pieces that the community is crying for. And leave aside the issue that the planning for this should have been 10 years ago, but we need to start the planning now to ensure that these bits and pieces aren't going to, I'll use a term, cannibalise and destruct a whole range of other workforces in other sectors, the consequences of which, let's take the AOD area because that's one I'm familiar with, if we get clobbered in this cannibalisation, our people will end up dead, in prison or in hospital beds, which is so much worse.
I don't have the answer about how you do it, Sam, other than that you've got to do the work, you've got to do the mapping now. You've got to do the mapping right now to know what the scale of the problem is. And then the answer is a bit, again, I think it was James's quote about there are many answers, that the answer to that needs to be co-produced with all of you, right? The department needs the information. You need the information together about what the workforce challenge you've got is. How many workers are there currently in the sector? How many are there in AOD? How many are there in mental health? What's the growth going to be? Where are they going to come from? You need the data. You just need the facts. And then you need to think about, well, what's actually going to be possible in terms of the staging and steps. So, and you need forums in which that's really listened to in terms of bringing those perspectives together. Did you have a question? Oh, sorry. Go.
Micaela, Kevin Myers from Nexus Dual Diagnosis Consultation Service. Thanks for your presentation. One of the major questions that I have is your issue of how you sustain workforce development and what we've coined the term the training trap. So a lot of the work that we do is trying to persuade organisations that it's not about sending people to a one-day session where they learn how to do things, but you have to support them through. And that also goes down to the tertiary sector as well. Unfortunately, the tertiary sector, as you said, often teaches people lots of things, but not how to do things. So I'm just wondering if you've got an example of how you've been able to change that trajectory within organisations. And I'm going to happy to catch up with you later to talk about how we do that, because we've developed a number of tools and resources which we think can actually work at the tertiary level, support people into leadership and provide that mentoring and implementation process.
Excellent. Very happy to catch up and talk about that some more. I think, so we kind of sit, I have to do like all of you do, kind of talk to my team about some days about just how difficult the work is, because our team sits at the pointy, bumpy end of every bit of the system that's not working. We wouldn't exist if the training sector was doing what the sector needed. So we've often got very grumpy people because we're always asking, when my team described it one day, we're always negotiating, because we have no real levers or power over anybody. We're negotiating to get people to do things a bit differently, whether that's government, training providers, sector, and we know that there are bits that are not working in each of those sectors. So that's what my team's job is to do, is the constant negotiating and listening. And I met with, on Friday, one of the programs we've got is a entry-level traineeship into disability and aged care sector. And part of the funding, core part of the funding, is for what we've called mentor roles. And the whole point of those mentor roles is to help those people who are new entrants or middle managers going into training. There are two components to it. Navigate both the education sector and moving into a new industry sector. And listening to their stories about what they have to do and how much they get pushback both from the sector, from within. The good thing is within RMIT I can do, you know, but even then. So those roles have been really critical, the mentor roles, because the whole point of those roles is to help improve retention. And we've dramatically improved retention in the courses that we've had an impact, been able to help shape the curriculum, but critically the assessments, because if people are doing work while they're learning, ensuring that the assessment they do is something that's really going to add value to their workplace and to them, they're going to learn from, that makes a huge difference. If they've got I remember studying, I've done nearly all my study while I'm working and I've had kids. If I'm doing something that I can directly relate to my work, I can find time to do it and energy to do it, whereas the assignments that I had to do that bore no relationship to what I was doing at work and were really boring, I remember those ones, they're painful to get through. So the mentors can help influence that work too. So I think what can you do about helping shape curriculum, both accredited but also short courses, and helping training providers understand that the short courses need to build. We need to be thinking about how you can articulate skills when you need them, you know, skills point in time. I need to know this thing because I've started, then I need to go away and just do something else, and then I need to go back and learn this thing in a much more planned way. We all need to get better at that.
We've got an online question from Marie. She said, we also need to think outside the square we're currently in. How do you suggest we support the move away from doing what we have always done, which is obviously not working?
I think that what's the case for change, what's the burning platform? I mean, I think that was why I did, where is it? This slide. I think everybody's recognising we've got a serious burning platform. We absolutely have to do things differently. We're not going to get we need to aim for 300,000 more across Australia. So, I mean, Commonwealth Government is interested and engaged, and the other thing is, how do you leverage off what are the bits that they're interested in? The federal government is very interested in aged care workforce. Well, that's not directly, it's relevant to mental health and AOD, but how can we leverage off that? How can we leverage off what it is that they're going to invest in and are interested in? I'm really looking at how do we leverage off that for the data work that I've been banging on about for years needs to be done. How do we leverage off the investment in mental health now to think about what's the opportunity for AOD rather than just what the risks are? Where's the opportunity? How do you leverage off where government's interest is? And we're going into a state election. So we've got window at the moment of capacity to really advocate and influence, and we should all be jumping up and down about these things. Because it's also, I mean, the other thing is government, the remnants of the service delivery that government do is predominantly child protection, but they still do work, you know, they still deliver some services across family violence, homelessness, not a lot anymore, but there's ways that we need to be advocating and influencing. How do you do things differently? Because the burning platform is absolutely there.
Hi, how are you going? Thank you. I'm Steph. I work at Primary Care Connect. We're based in Shepparton. You talk a lot about collaboration, the increase in staff, which is probably based around the increase in need and support.
Yep.
What are your thoughts around, you know, working towards prevention and promoting the services, and I guess maybe some policy changes and that sort of thing?
I think, and Sam kind of made that point too before about the balancing. How do you just keep doing the work you need to do now? But actually all of us know that unless if we we invest as a community in early intervention and prevention, the pointy end's just there's going to be increasing demand. If we don't do anything about that now, your point before, Sam, about people end up in emergency, what was it? Dead prison in emergency departments. If we're not doing the prevention work, same thing in child protection. If we're not doing the work with families to support them, then we know what the trajectory is for children who end up in care, and what happens for the rest of their lives. All of the having a getting, and that's tricky, isn't it? Because government and a lot of the people like Catherine and the other colleagues who were here from government are saying, they're advocating, they go into those jobs with a passion that's pretty similar to ours, and they're advocating internally for this, and the department, health does a better job advocating, and that's largely because they've had the data. They have the data about the numbers of people who end up in emergency departments and hospitals. Community sector has been terrible at data, at demonstrating demand, at demonstrating the impact of not doing the prevention work on demand for services. Schools get funded based on the number of kids who turn up on census day. Hospitals get demand, more likely demand funded. This sector never gets demand funded because we can't demonstrate and we can't make the connection between how we're going to reduce demand if we invest in early intervention. So we need the data. We need the data and the evidence to be putting a very strong case, and then we need to go with what some of the solutions are about how do you move the investment? How do you shift the investment from one end to the other?
Last question.
He gets to boss you round now, Sam.
Yeah, he's a bit bossy, isn't he? Just to give some credence to what you're saying, I was fortunate enough to be in Norway talking to their prison training authority over there, and the whole session was run by an epidemiologist and a criminologist. And what one of them said is, I've got to go to another meeting because I'm looking at a database of how prisoners are moving through the welfare system.
Yep.
And they were able to highlight where the peaks of concern were, and they were developing program activity to address those blockages which was creating that problem. And as a big picture sort of thing, they were able to reduce their recidivism rate from over 50% down to 20% by applying appropriate pragmatic policy shifts and using that money to reinvest back into those activities, which could be done in the preventative sense in our AOD, mental health systems, all that sort of stuff.
Evidence is critical. We're doing some work at the moment with the ABS to look at how we can access government's big data sets, so Centrelink, tax, Medicare, training provider data, to see what we can do about mapping big picture stuff about workforce, completely de-identified, very careful about privacy issues. That we need that data. Nobody has the very clear data about. And what we're doing at the moment is just getting the base data about workforce. But what we're interested in is what you can eventually do around, well, what are the workforce characteristics that have a big impact on outcomes, that get better outcomes for people? There's, again, a lot of assumptions. A lot of assumptions that if you run an aged care centre for Italian people, you're better off having Italian workers. Well, there's a lot of good anecdotal evidence, but where's the actual evidence to back that up that will improve funding to resource that? So data, and so my one kind of final plea would be, you can do some of that using this MADIP, Multi-Agency Data Integration Project, but some of it is the data that you all need to input and provide, about yourselves when you get surveys. There's surveys that come out, workforce surveys, there's at a worker level and an organisational level. What we're trying to do is get it more streamlined so that all we're doing is asking questions that you can't get from those big data sets, so that we can plan more. So we need to get smarter about having a better view about what the workforce currently is, completing those surveys, helping government make sure that they're asking the right questions, and making sure that they share the data when they get it, because they're not terribly good at that either. But we're about to share the data that we've got from the January project and send that out. So yeah, understanding who the workforce is, working on what the recruitment, but critically the retention, and then thinking about how you have entry-level pathways in to train people, upskill them, and skill your leadership are the critical things that we're working on, and very keen to partner, particularly work very closely with the peak bodies about that. Thank you.
Thanks everyone, and thank you again, Micaela, for a wonderfully informative session. I could talk more about it, but I can see lunch is in there, and I assume people are hungry, so I'm just going to let you go to lunch, and breakout sessions will resume at 2. Thank you.